bills that have been introduced in the legislature that restrict or deny a woman's access to reproductive health care, especially abortion. And that's why we're joined by Senator Linda Lopez and Representative Steve Farley to hear about the bills Arizonans should be concerned about when it comes to women's health. HB 2443, a bill that bans race and sex selection abortion, implies that women are choosing abortion based on race or gender. This bill and its sponsor, Representative Montenegro, have received a lot of media attention. Why do you think this bill is getting so much coverage when it has been exposed that this is not a problem in Arizona? And what is the real purpose of this bill?
Well, we know that abortion for the purpose of race or gender selection does not exist in this country. The evidence is clear in that regard. And if there is an increased amount of abortions per capita amongst women of color, it's a large part a result of, and almost entirely, of poverty. And there's nothing at all in this bill to deal with the root cause of poverty. Everything they were talking about on the floor attacked Planned Parenthood, attacked the idea that abortion would ever be legal, and attacked all women's reproductive rights. It said nothing about this issue as being the ultimate end of this. They were just attacking and attacking and attacking women's reproductive choice. And that's what all these bills seem to be doing. It's not an effort to actually fix a little problem that's here. It's an effort to attack a Supreme Court decision that they don't agree with.
Why do you think some legislators are focused on manufactured issues such as HB 2443 when there are other bills that will have a real and detrimental impact on women's access to care?
You know, I think that Representative Montenegro and others like him who are introducing these really negative attacks on women and women's moral agency are at the detriment of paying attention to things like defunding access and defunding access for women's access to health care. Those are a lot of accesses there. But the reality is it's to keep the public's eye on something that's not a real problem when the real problem is that women cannot get health care, cannot get the health care that they need, and that there's a move here at the legislature to completely do away with health care for low-income, poor people in this state.
What will be the impact of the various anti-abortion, anti-women's health bills on a woman's access to health care?
To me, the biggest impact on all of these attacks on women is, first of all, it limits women's ability to get the health care that they need, particularly women in rural areas in this state. But more importantly than that, I think, is the whole idea that members of the legislature know best what's for women. How dare they? How dare they think that women cannot make decisions about their own health needs without interference from the government?
The supporters of HB 2384 claim they are closing loopholes to make sure public money is not being used to provide abortions. So let me ask you, are there loopholes to close up?
The idea that there are loopholes to close up with the tax credit is just absolutely unfounded. The tax credits that folks get, those dollars, first of all, they don't even go into the state budget. They go directly to the organizations, not into the state budget. And those dollars are not being used by Planned Parenthood and other organizations to fund abortions. They're for family planning, for other health care services for women.
The conservative lobbying group, the Center for AZ Policy, calls these tax credit eligible donations taxpayer money. Do you feel that donations to organizations that provide services for the working poor are tax dollars, and should they be restricted?
No, those dollars should not be restricted. And it would be interesting to ask the Center for Arizona Policy and those legislators who support them whether or not they consider the dollars that go to the school tuition organizations and private schools taxpayer dollars. They certainly don't do that when we're considering STO monies.
Arizona has the third highest teen pregnancy rate in the nation, and 1 in every 4 teens has a sexually transmitted infection. Why are some in the legislature ignoring these real issues? What do we need to do as a community?
Well, You know, they're ignoring the real issues because it's easier to attack women and women's ability to make decisions about their own health care. They'd rather try to undermine women and their access to health care, their access to reproductive health care services that they need, because it's easier than addressing the underlying cause, the fact that they don't want to allow comprehensive, medically accurate sex education in schools, so on and so forth. They don't want to fund that sort of thing. They don't want to allow it. They want to legislate morality in the state of Arizona. As far as what we can do about what citizens in Arizona can do about this, they need to be holding their legislators accountable. They need to be calling them, emailing them, meeting with them in their home districts, and telling them, you know, look, you cannot do this. You cannot act as healthcare providers at the state legislature. That is not a legislator's job to be a healthcare provider. And so they need to back out of these anti-women policies.
Let's talk about action for a moment. What can citizens do to voice their concerns to the legislature?
Well, the emails are one thing, but the most important thing you can do is work to elect different people. That's what we have to do. Elections are important. You can't just forget about voting further down the line after you voted for president. Legislatures, I think, are even more powerful than Congress, than the presidency. And if you don't go out and work for a campaign, not just vote, but work for a legislative campaign, then you're making it easier for the people who don't have your best interests in mind to get elected. So get out there, elect good people, understand where they stand on all these issues, and make sure that we can change the people in this legislature.
They are Senator Linda Lopez and Representative Steve Farley. And to protect women's reproductive health rights, visit ppaz.org. That's ppaz.org.